Giovanni Leoni of Liverpool went down with a very concerning knee injury in his debut against Southampton. Initially, at the time of the injury, there was a lot of speculation regarding the severity because it required him to be stretchered off of the field. It looks like as of right now, we do have an update regarding the severity of that knee injury. Sources are reporting that he has in fact suffered a torn ACL and he's going to miss significant time. The ACL, or the anterior cruciate ligament, is going to attach the femur bone to the tibia bone, and it is absolutely crucial for stabilizing the knee. So with today's video, what we're going to do is first we are going to examine the injury replay. We'll talk about the potential mechanism of injury because the injury replay is not particularly clear in this case. And finally, we'll discuss what Leone should expect moving forward. Ladies and gentlemen, welcome to my channel. If you're not familiar with me, my name is Nick Gallo and I'm a doctor of physical therapy. With my channel, I take a look at sports injuries and I try to explain them so that they are a little bit easier to understand. I'll also talk about the pertinent anatomy for those injuries, as well as dive into the rehab process. If you enjoy this content and you would like to see more of it, please hit that thumbs up and subscribe to this channel because I will be making more of these in the future regarding sports injuries, rehab, and other physical therapy related content. Also, if you yourself have suffered an ACL tear, go ahead and comment in the comment section below. We see here on the injury replay that as Leone is going for the ball at the last moment here, he is going to stretch out with that left leg and he is immediately going to fall to the turf. Here I have a model of the knee, and so the most pertinent piece of anatomy for this injury is of course going to be that ACL, also referred to once again as being the anterior cruciate ligament located right in through here. As we flip the model medially or towards the inside, we have the medial collateral ligament, or the MCL for short. As we flip the model laterally or towards the outside, we have the lateral collateral ligament, or the LCL for short. And then as we look on the back here, we have the posterior cruciate ligament, or the PCL for short. Also in the model here, there are two blue pieces that are representing fibrocartilage, and this is the medial and the lateral meniscus. The ACL specifically is going to attach the femur and the tibia bones in a direction where it essentially is going to prevent any sort of anterior or front slipping of the tibia away from the femur. So that's one major function that the ACL has, is it's going to stabilize the knee joint in the plane of going anteriorly. And it also provides a big rotational stability to the knee to prevent any sort of caving inwards of the knee. This is a position known as dynamic knee valgus, and it can be a very compromising position for injury. Now let's go over some injury mechanisms that will result or can result in an ACL tear. The first one is essentially going to be any sort of force that's pushing the back of the tibia going forward. This is because the ACL's predominant function is to prevent any sort of anterior movement. If that force happens to be great enough, then this can absolutely lead to a tear in that ACL. Because the ACL also functions to provide a rotational stability at the knee, any sort of twisting or rotational force going through the knee can also lead to an ACL tear. I briefly touched on this term earlier. It's called a dynamic knee valgus, where a person is going to be planting and they are trying to pivot. If we see this and the force happens to be great enough, we get that inwards caving of the knee, which is a highly compromising position for not just the ACL, but also other ligaments and structures located within the knee, but the ACL being the big one. It's important to note that in the dynamic knee valgus position, specifically the medial meniscus as well as the MCL can be at risk for injury. We have not heard any reports confirming that any sort of knee structure besides the ACL has been implicated, but it's important to know that this can result in a multi-structure injury. And finally, an ACL tear can occur in another position known as knee hyperextension. This is going to be where essentially the knee is going to bend backwards and it's going to bend beyond its normal range of motion. You can see as I do that on the model here, it's stretching and stressing all of the ligaments located in the knee, but if it's great enough, it can affect that ACL. We see here that as he's running for the ball, he is essentially going to stretch out or extend that leg, and he's going to plant at this moment. As he plants, his body keeps rotating away from the knee. So this makes me think that based on what we have in this injury replay, it looks like he is getting a lot of that rotational force that we talked about earlier, which can be highly compromising for that ACL. This twisting motion, on top of the fact that his knee was extended, we already know hyperextension is also a very compromising position for the knee. This can greatly put the ACL at risk. Also, looking at the injury replay, pretty difficult to tell if the two players made contact here, but just given the fact that it looks like he is getting a lot of rotational force going through that knee, as well as that knee being extended with him reaching for the ball, this unfortunately was enough to result in the worst case scenario, that being the full ACL rupture. If you've watched some of my videos in the past, I usually try to talk about some sort of on the field or in the clinic test that we can do if we think somebody has suffered an ACL tear. And the one that usually is the go-to is one known as a Lockman's test. So we're going to have the person lie down, we're going to bend their knee, and we're going to put the tibia in through the action that the ACL is essentially going to prevent. So it's going to prevent anterior slipping or anterior movement of the tibia. We try to move the tibia forward like so. Then what we're going to do is we're going to perform that on the uninjured knee. If we feel increased laxity in the injured side, that makes us think that the person has suffered an ACL tear and they need some more advanced imaging. And this is where we get into the official diagnosis. When we're talking about a full ACL tear or an ACL rupture, this is consistent with grade 3 on the grading system. Once again, absolute worst case scenario. A grade 1 is where you're getting stretching of the ACL, and a grade 2 is where you're getting partial tearing. A grade 3 is absolutely going to result in somebody having an ACL reconstruction, and the ACL is essentially going to be rebuilt by one of several options for the graft type. Some surgeons will use the patellar tendon, some will use the hamstring tendon. It really depends on the surgeon. After this, the person is going to be in a very long brace known as a drop lock, because they're going to be immobilized for a period of time to allow things to start healing. Then as we progress down the protocol, they're going to be coming to physical therapy. We're going to gently start working on range of motion. And if there happen to be any weight-bearing precautions, let's say if the meniscus or another structure in the knee is injured, sometimes this will dictate whether or not the person can weight bear right away. Then we're going to navigate that appropriately. Once they can start weight bearing as tolerated and eventually come out of the brace, then we can start to get more advanced with the rehab process. But unfortunately, this is quite lengthy. It can take anywhere from about 9 to 12 months. So we wish Giovanni Leoni the best of luck moving forward with the rehab process. Unfortunately for him and Liverpool, this was the absolute worst case scenario, but we wish him the best of luck moving forward with the rehab process. If I happen to hear any specific details regarding that, I'll be sure to update everybody in the comment section. Thank you so much again for watching my video today. I really appreciate it. If you enjoy this sort of content, I'm going to go ahead and link one of my playlists so that you can watch some of the injuries that I've talked about in the past. Thank you so much again for tuning in, and I'll see you next time.